My name is Frank Gallio. I am 72 years old. I had RK done 40 years ago, and Dr. Gulani was the only one who a year ago, almost a year ago, performed surgery on my cataracts because I was told that no one could perform surgery. It was too risky. And here I am almost a year later. From day one, my first eye, I saw perfectly, so I was very confident about the second eye. And now both eyes, I can see beautifully, don't need glasses for reading or for far away. As a matter of fact, I was telling the doctor that this morning I was at my son's house, and for the first time I went in and took a shower, and I could see which was the shampoo, which was the conditioner, because I don't need glasses anymore. I can just see perfectly. And I'm just amazed. And I was just wondering, are there any other surgeons who can perform that kind of surgery?
Well, Frank, first of all, it's a pleasure sitting with you. As you can see, it's Monday morning.
Yes.
Very busy with patients landing. Many of them RK cases are landing from all over the world, but it's always a pleasure when any of my patients will ask me for doing this with y'all. I call them grilling sessions, impromptu. So for all the RK radial keratotomy patients watching, this is a wonderful gentleman. All my patients are amazing. Came to me with 20 cut radial keratotomy cornea with scarring, very dense cataract, and very high regular stigmatism. And we did a LaZrPlastique surgery, which is my concept of performing surgery, including removing the hard cataract without stitches in these eyes. And how bad was the surgery?
That was the amazing part. I could feel pressure, but there was absolutely no pain. And after a couple of days, my vision just kept getting sharper and sharper.
So we did the surgery, in most cases with just numbing drops, and the most important part is not even that, it's the intensity. So Frank, none of this is easy as you can imagine. I have to look through those 20 cuts and perform surgery on difficult situations. Plus, I'm aiming for a mathematical endpoint, your vision, which actually is very difficult to predict. As you know, I'm just blessed that all of you are doing so well, my patients, RK patients. But as you know, none of you are guaranteed the outcome. In fact, you'll sign pages of consents that say that you will not see well or whatever, because it's a fact, your corneas are RK. So this concept for all radial keratotomy patients watching is how to leave back your very distorted, if I may, broken, scarred radial keratotomy cornea and yet make you see through the optics inside the eye. That's what makes this very difficult. So many surgeons are capable of doing cataract surgery, as you know, but there are very few who can do cataract and refractive techniques. And then very, very few who can understand radial keratotomy optics, which are so distorted and changing all the time, and do it. So I've been teaching these concepts for now 3 decades to my colleagues all over the world, and teaching it actually through my patient experiences. As you can tell, I'm still addicted, enamored with the outcomes I see with all of y'all. So LaZrPlastique is a concept where most of you are coming to me at a cataract age, all right? And at that point, I go inside your eye, I work on the optics through different technologies, and I cancel the optical imperfections of your RK cornea without touching the RK cornea.
Right.
If you had come to me in your 40s or when you're early 50 years of age, I can do LaZrPlastique on your RK corneas and shape you and make you see despite your cuts. But this is more difficult surgery. I'm entering your eye, looking through these cuts, operating, you're alive and breathing. And I have to be optically so accurate using 3 decades of my experience for you to land at an optical endpoint, which is vision, despite those RK cuts still being there. In some cases, when the patients who come to me are so immeasurable, I actually plan 2 stages for them, where I first do a lens-based surgery, then later I come out and do a LaZrPlastique on their broken cornea, which are so distorted, to make them see. Again, remember, you may surely need some glasses contacts after surgery. I tell all of y'all, but I'm so just blessed all of you land with such amazing vision. And that's why I keep following y'all up, because this is my integrity and accountability, that I let y'all be on camera for no incentive. There's no Starbucks card for you, Frank.
Now, you were very upfront. You said, I cannot guarantee 100%, but I will do the best I can, and I can guarantee it's going to be better than it is now. And I felt the confidence in you, that I had a trust that you were going to do the best you could, and you certainly did. I'm so pleased with the results.
And doctors, every Sunday I'm here about 8 hours planning, alone, meditating, and planning for all RK patients who are landing because it's truly a commitment. Surgeries are extremely difficult for me because, again, I want so much out of y'all. I want to make y'all see. It's very difficult because there's no predictability. Remember, your RK cornea cannot be measured. Second, your RK fluctuates. So imagine a target that cannot be seen and the target's also moving. And you have to still physically perform a surgery through these difficult eyes without breaking open the RK cuts and come out without a stitch and everything that I like for y'all, and comfort and vision. And that's what I want doctors to do. So you don't have to come to me as long as you can encourage your eye surgeons to do these things. To answer your question why other doctors don't do this, I'm sure they are capable, but it requires a tremendous investment of time, focus. Of course, you can see the levels of diagnostics and technologies, the surgical suite that is specially made for these kind of cases, and the fact that you have to put in your decades of experience, 3 decades of working with all kinds of RK cases. There are many myths that have been brought up with number of patients from RK who have heard of me, and then they have a lot of questions because they've been told nothing can be done. Your doctors are not wrong. It is complex. But I do believe everybody should fight to, you're all dynamite people, RK patients. You're all type A, yes?
Yes, absolutely.
Personality doesn't change.
There's a healthy skepticism to that, but once you do your research and you see the success that you've had, I think the patient says
more than even success, Frank. As I said, I'm blessed with these results. I mean, like my patients now are telling me, Doc, just tell everybody you're amazing. Well, I could surely take credit for all the results that I'm getting, but I truly believe it's an outcome of tremendous commitment. I mean, I have to perform physically on these dangerous eyes. Then I have to repeat it on the other eye.
Yes.
Then I do it on your families and friends, you'll fly here. And each one of you are differently cut. So you're not even predictable.
That was going to be my next question. They're all a little different. Everyone requires
No, different. There's another myth I would quell here. I've done patients with over 40 cuts RK, and I've done their cataracts and no stitch, and they're seeing. And what my point is, it's not about how many cuts. Yes, more the cuts, more the difficult. But what is even more important are the associated problems. I recently did a patient from Cleveland. She was sent over. She had traumatic cataract under a 14 cut RK. Now that's horrible because the cataract's already dangerous. And you're doing it through these cuts and you want to come out with vision. Another patient I saw, an attorney, had Fuchs dystrophy of the cornea with 16 cut RK, with scars all around that couldn't help me measure. Again, difficulty level. So the 40 cut actually can be easier if it's nice straight linear cuts with nothing else going on. While a 4 cut RK, which has now become bulging and ectatic with scarring, could be more dangerous and more difficult to predict. So I hope that point gets across. There are many associated factors that you could have: your type of cataract, your type of irregular astigmatism, your magnitude of the refractive error, the scarring, the amount you fluctuate, and then the cuts and how the cuts are done. And then if you've had previous surgery, like many patients come to me after multiple surgeries. So have you had Lasik on your RK, which is a total no-no. If you had PRK over your RK, you had cross-linking on your RK, you had a transplant after your RK, makes it even more complex. So if you look at it from this holistic point of view, that's why I spend hours with y'all, if you remember, in your pre-ops.
Yes.
Hours, because it has to be a commitment. I have to dive in and help y'all, but it is very intense for me.
How many hours of preparation go into that brief surgery? Because the surgery did not last very long.
More important point is it's 3 decades, 30 years of experience. And then, of course, hours and hours every Sunday, even for your second eye, if you remember.
Yes.
Again, I work on Sunday, planning, deciding, and then I catch you and again measure you before going to the second eye. So it is intense, doctors. This is not magic. It's become a commitment. It's I'm indebted to my patients who are going on these rail keratotomy forums and sharing their experiences. None of them are incentivized. None of them get anything from me. Of course, my thanks all the time, but these are actually not even normal people. All of these patients, all of you RK people are very intelligent, very well researched, very accomplished, and yet you're spending your time talking about me. I'm indebted. I don't do this for money. I don't need more patients. I'm blessed, but it's become a calling. It's become a calling. So I can never say no. When you ask me, sit down, doc, some questions, it's always a pleasure. Whoever I can teach. If you can inspire your doctors, please. I've been doing it for 3 decades, teaching eye surgeons all over the world. if you can go back to your surgeons and inspire them to fight for you, not to give up. Contact lenses, Frank, another question you had before. Contact lenses are great modalities, scleral contacts and all that, but that's what I call a Superman suit. You're putting that on, you can see. You take it off at night, you have a 40-inch waist. That's reality. So your vision is not only poor, you're not being treated, and as time goes on, underneath the contact lens, your cornea is deteriorating more and more and getting scarred. By the time you come to me, even more difficult for me to fix you. So even though contact lenses are very important, I like that if in case I cannot reach perfection with you because of your RK or whatever level of impossibility, then after my surgery, you can surely wear a contact. Absolutely, that's a great role. But to put it on without surgically correcting and letting you stay with your fractured cornea getting worse underneath over time is not right. That's my take on that aspect. So the lens implants, doctors. Many people ask me, Doc, new lens technologies. There is a lens that can be adjusted called light adjustable lens. There's a lens which is small aperture pinhole lens. Think about it for a minute. If a tailor provides you with a suit and says, I have included 4 alterations, what does that mean?
He didn't do it right the first time. He has to come back and keep redoing the alteration.
Well, exactly. Not only that, it is giving that tailor the opportunity to not work hard. Because he already told you, I'm going to alter this. So, all these technologies, remember, I love technology. I'm always among the world's first to do these things, even before FDA approval, because of my international privileges abroad. But there has to be a logic. You can't just put in a lens without spending the energy, time, or experience in planning for him, and just because you have 4 opportunities now to readjust it. It does not make sense. Second, I've seen a number of these patients come to me miserable with their outcomes. Some of them I've even fixed. And then the small aperture lens, another great advance in technology. But again, for cases that cannot be corrected, cannot just put it in every case because you don't want to work hard as a doctor. So that's my take, please. Nothing wrong with it, that's my take. My take is all RK patients can see. They are very complex, very difficult to work on. Yes, honestly, I tell them there is no guarantees of any outcomes with me, but I'm blessed with the consistent results I've had over 3 decades and the fact that all of you are real people. And that's why I've done something very difficult, Frank, if you can imagine. All of you I have put on video. During surgery, post-surgery,
Yes.
as you'll come for follow-up.
Yes, I remember.
No doctor I know of has done this for 3 decades. That too, not ordinary patients, remember. Very easy to put an easy Susie on your video when you're doing a simple LASIK, right? You are predictable. You know the result's going to be great. But I'm working on unpredictable, very intelligent, demanding patients who many a times are skeptical when you come.
Yes.
Right? And that's my way of holding myself accountable, that I want them to question me because I don't have to do this. It's become a calling, an honor.
Well, I'm pleased that I found you, and it's a pleasure knowing you. Thank you. I'm
Always.
very, very happy with my results.
So please, patients of renal keratotomy, no matter what your complexity, also if you've had cataract surgery, no matter what lens is put in, you can still be helped with LaZrPlastique. So there are so many ways to help you. Don't give up. Don't give up. It's my pleasure. And of course, there's a lot of information on our website, GulaniVision.com. And I'm always here to answer questions for you, your eye doctors, your optometrists, your eye surgeons, anybody. So please don't give up hope. You can be helped. Dr. Gulani. Frank, anything else you want me to say?
No, that's about it. Except
Impromptu Monday morning.
Why aren't there more doctors like you? Is it too difficult?
I'm sure there are, Frank. It's just, I want doctors to enjoy the relation that patient-doctor can have. I want them to fight for each one of you. I want them to treat you all like family, produce the results.
Right.
So that's become really, as I said, it will happen. I'm sure there are many good doctors on this planet.
That was the other thing. You didn't make me feel like I'd rush me in, rush me out. That you took all the time I needed. For you to answer my questions and make me feel comfortable with the surgery.
Of course.
So thank you very much.
Great seeing you back.
Thank you.
And now this is another thing, and I get involved, it becomes a lecture. Now we're doing m.o.i.s.t therapy for Frank,
Yes.
which is for his dry eyes, which is also very important because your broken corneas, the tear film breaks down a lot, which we'll do today for him. Ad is 1 year post-op. I can do it at 3 months post-op, before surgery, depends on how bad each one is. So again, look at the holistic approach you should have. The tear film, the corneal aspect, the lens aspect, the optics aspect. We are literally repairing a damaged system. So it is difficult and unique because each one was cut differently. Right?
Good push, Frankie.
Let's go.
Thank you.